Hello, everyone. My name is Trung. I am an assistant professor at the Department of Industrial and Manufacturing Engineering, and I'm also a joint faculty member with Biomedical Engineering departments at North Dakota State University. This is a joint work with Dr. Vedi Sethi, Dr. Miran Blanchard, and Andrew Terrell from Sanford Health. In this post, I'm going to present to users research entitled Smart IoT System for Obstructive Sleep Apnea Monitoring and Forecasting in Cancer Patients under Radiotherapy. Cancer patients with comorbidity have a really low treatment outcome as well as low survival rate. And one of the most common comorbidity in cancer treatments is obstructive sleep apnea, or OSA in short. Head and neck cancer are actually the prioritized groups of patients whose OSA severity need to be fully monitored because most of the treatments on head and neck cancer affect upper airway, which is the major effective regions of OSA. There are many causes of OSAs in head and neck cancer patients. The uses of opioid, the sedative, narcotics, and radiotherapies also increase the higher risk to the hypoventilations of the upper airway. In this research, we're focusing on the hypothesis that the IoT or Internet of Things will be used to help doctors to provide predictive and diagnostic information for OSA during the treatment, especially the head and neck cancer treatment. We're gonna focus on two aims. The first aim gonna develop a smart Internet of Things system, and the second one is to characterize the association of radiotherapies to OSA progression during the cancer treatment. According to the two aims, we're gonna realize it into two main tasks. The first one, we will develop an IoT architectures in which we're gonna have the IoT platform with computational and storage capability, and also a security and privacy mechanism. And the second task, we're gonna focus on collecting and analyzing the longitudinal data. We will use two devices. One is our own customized device. The second one is an FDA's approved wearable sleep diagnostic devices. This is a product from Sleep Philips Alex PDX device. And the FDA approved device will be used to validate the accuracy of our devices and our system. Furthermore, the longitudinal data will be used to compare the severity of OSA before the treatment, during the treatment, and after the treatment. This picture, the stage one, the figure number 2 showed us the collecting clinical data procedure in which we're gonna coordinate with Sanford Hospital, Sleep Center, as well as Roger Melrose Cancer Center to recruit patients and train patients to collect the data for 3 nights by themselves at home using two different devices. After 20 setup data will be collected, we're gonna characterize the relationship between the radiotherapies in terms of the doses and the volumes toward the change in the substructures as well as the AHI progression. And finally, we're gonna investigate the relationship among those targeting subsites on OSA progression. And finally, the model gonna be used for the onset and long-term AHI prediction The expected timeline and outcome has been shown on this table. Accordingly, we're gonna perform the aim number 1 and number 2 according to three different 2-month periods. The reference of the work has been reported down here. Thank you very much for your attention.